Hi everyone, welcome back to Teeth Talk with Whitney. I'm Whitney and I'm a registered dental hygienist. Speaking of, have you seen your dental hygienist lately? COVID-19 impacted every routine, day-to-day activity in our lives, whether it was sending our kids to school in person, physically going into our office to work, or even whether or not we felt safe enough to see our doctor for checkups. Most of us had suddenly wide open calendars for the first time that we can even remember. And for a lot of us, some of these openings came from canceled dental appointments. Maybe it was a filling you knew you needed, but the dentist's office was closed because of the shutdown. Or maybe you were due for a cleaning or gum disease treatment, but you were just too nervous to go back in. I mean, what about all those aerosols floating around in the dental office, right? Reports have shown that just in the United States, dental services fell by 80% in the immediate months after the pandemic. Basically, if you needed anything other than emergency treatment, we weren't going to the dentist at all. And it wasn't just that people were scared to go to the dentist, it was more that dental offices were shut down because of social distancing. Unfortunately, dental problems like cavities, cracked teeth, or leaky dental work almost always get worse with time. So if you're not seeing a dentist to treat them early enough, those issues become bigger and more expensive problems to treat. Now, even though most places, including dental offices, have opened up, when you combine the uneasiness some of us feel about COVID-19 with the fact that you might need more dental work than normal, it can be a recipe for dental anxiety. Before COVID, it was estimated that about 1 in every 3 adults had some type of dental phobia. That included mild dental anxiety to severe panic attacks that kept them from seeing a dentist at all. Mental health is something that we're all taking very seriously these days because of social distancing. The time that we've physically spent away from other people has created a sense of stress all on its own. And so, when you pair the emotional fatigue of COVID reopenings with everyday dental anxiety, you probably have all the more reason for internally justifying not going back to the dentist. Especially if you're worried about whether or not the dentist's office is a safe place to be. Now, with normal dental anxiety, and we're talking pre-COVID, one of the best things to do to ease yourself back into the dental office is to find a provider that you trust. Someone who makes you feel comfortable and explains things to you. Then, once you take care of those more important dental health concerns, you can go back into a routine maintenance scheduling of keeping your smile healthy. Something like 6-month checkups. That way, big, painful emergencies aren't constantly popping up. Otherwise, all of those delays in dental care just compound your oral health problems. So now that we know it is safe to return to the dental office, you can rest assured that you're going to be in good hands. Most offices have ultra strict COVID protocols they've put into place to keep both their staff as well as their patients as safe and healthy as possible. If you look at it this way, it's definitely going to be easier to go back to the dentist now than it is to wait even longer. Because by the time you have a tooth problem pop up, you could have already addressed it in a smaller and more affordable manner. I know that dental anxiety is very real. Past experiences in the dental chair can get in the way of routine care needs like cleanings, exams, and even fillings. The best thing to do is to find a dental office that you trust and who puts your concerns first. And if you want, find one who offers sedation, nitrous oxide, or simply the most important, the one that you feel comfortable with the staff. Right now, the dental office is one of the safest places you can be, especially with all of the added sanitation, filtration, and infection control protocols that are being taken. So make an appointment now to get back into your dental care routine. It's like oil changes. When you keep up with them, there's less of a chance of problems that come out of nowhere. So call your dentist. Your smile will thank you now and in the future. Thanks for joining me. I'll see you back next time.